Saturday morning, and I just kind of making a quick update. It can't be longer than 10 minutes, of course. And I just wanted all of you to know that the previous recordings that I made at a very dark time in my life, a time that I allowed myself to go back to, very difficult time in my life. And I appreciate any comments that you may have. Of course, if you have judgments to pass, please remember that you'd have to walk in someone's shoes that have MS first before passing any judgment upon them. Second thing I want to mention to all of you is that right now, time in America, we're going through a lot of changes. Some may be looked upon as good, others as not so good. And I want to take a moment to explain to you the illusions that can be given out to people, especially people who are vulnerable, people with chronic diseases like MS. You might get information that somehow a socialized medicine route would be best for your chronic disease, and let me just say that it is not. It is what you really have to bear in mind is that a government does not want to, the government would not want to fork out the kind of money necessary to control this type of disease if it didn't have to. Tysabri is a very expensive medication to receive. It is a there's quite a lot of course, dangers associated with it if you don't know anything about it. PML is something that is a big issue with it, and I have family in Europe that told me firsthand, because one of them happens to be a biochemist, and I can't disclose anything else about that, but that he explained to me that thank goodness that I lived in America and had the option of Tysabri as a treatment, because quite frankly I may not have received it living in Europe. They like to make people think and send them under the illusion that somehow they're taking very good care of someone that has a catastrophic disease by sending a nurse's assistant to the house maybe once a month to your home, making a home visit, and taking all your vitals to make sure that your heart's still beating, and they'll offer you a wheelchair. But I wanted to walk as anyone with MS would like to be able to walk, and these options become a lot fewer and far between when you think about government-run insurance that could possibly put a stop to choices that you may have under private insurance. And I understand that when you're healthy, that socialized medicine is a great route when you just have a cold or something like that, because they take care of all of that. But when you have a catastrophic disease, and I'm not so sure, I need to check into it more, maybe you all can let me know. I'm not sure about how the research goes, as far as because I know most research is privately funded, and so if the government is taking over this, why would they be interested in funding a lot of research for things like MS? It's going to be extremely expensive. Just a thought. But personally, I don't want it, because I want as many choices out there as I can possibly get, not just one choice. I don't want my health being taken over by one source. and one person sitting behind a desk saying whether or not I can receive a medication. So I'm only telling you this. This is the way I feel about it. I'm not trying to inflict it on anybody or anything. I like to learn a lot, and I've been learning quite a bit about the medical insurance plan that Barack Obama has in store for us, and I'm not sold on it at all. I like options. When I was in that position, when I had options available to me, I was so thankful to God that I had those options, especially when my cousin who lives in Britain said to me, "Be so happy that you live in America right now, because if you lived here, the odds are they'd give you a wheelchair and a nurse's assistant and pat you on the back and say, good luck to you." They don't have your best interest. It's a necessary evil. I can't remember whether it was Benjamin Franklin that said it or George Washington, but one of them called the government a necessary evil, in which it really is. We need it. On the other hand, we don't want it to take every single solitary right and decision we have left. When you have MS, you have so little control as it is. To think that somebody's going to be sitting behind a desk and make decisions about your health kind of pisses me off. I mean, as it is, we have to answer to insurance companies, but then you've got the backing of your company that you work for, or your husband, in my case, my husband works for, to put pressure on these and have advocates out there that are working on your behalf. So it's a little bit different. You have more options. I don't want every option I could possibly have be written off and given away. I feel like our rights are being intruded on, especially now. And you know, it's a lot easier in Europe and in Canada just to let people, you get old and you're an old lady and you're an old man and you're suffering from heart illness and things like that. You think they're going to give you a bypass and you're 75 years old? Heck no. Bye, Grandpa. Bye, Grandma. I mean, that's basically what it will be like, in my opinion. My father had to have triple bypass surgery a couple of years ago, and he had a new aorta replacement. I don't think they ever would have given that to him. If it were up to the government to do, the cheapest route would have been to just say, you know what, Gramps, sorry about that, but very costly. They wouldn't say it like that, but boy, you'd know it by the end, because you'd be put on the bottom of the list, at the way below bottom of the list, to the point where you would be there, you know, you may as well just say goodbye and write your will out and bye, everybody. Everything's great for young people under a socialized medicine, because you're healthy. You know, you're healthy. And when you're healthy, nothing catastrophic. You can't think to yourself that would ever happen. Let me tell you something. I was great one day. Not great, but I mean, I wasn't feeling well for a while, but I woke up one day and I was paralyzed. And guess what? It can happen to you too. If you think that it can never happen to you, listen to my story again. It can happen to you. Anyway, God bless. Bye. Have a nice weekend. Thanks for watching.